Now I'll discuss one MCQ. A 45-year-old man with a lesion involving the nerve to stapedius presents with difficulty tolerating loud sounds. During testing, the acoustic reflex is absent in the affected ear. Which of the following best explains the physiological consequences of this lesion? So now we'll first discuss regarding what does acoustic reflex means. Acoustic reflex, otherwise known as attenuation reflex, so whenever there is a loud sound transmitted through our ear, it reaches to the cochlea and it finally reaches to the higher center, to the CNS. There is a sudden reflex occurs. There is a sudden reflex occurs with a latent period of 40 to 80 milliseconds. Okay, that causes contraction of stapedius and to a lesser extent contraction of tensor tympani muscle. Okay, so that this acoustic or attenuation reflex causes contraction of the stapedius muscle and to a lesser extent causes contraction of the tensor tympani muscle. So what does it causes? It, if contraction of stapedius happens, that causes stapes to move outwards. Okay, contraction of tensor tympani this mechanism is a lesser extent it is happening, but it causes handle of malleus to pull inwards. Okay, so the stapedius causes stapes to move outwards, whereas the tensor tympani contraction causes pulling the handle of the malleus inwards, so that two forces opposes each other, thereby causes all the ossicular chain in rigidity, thereby causing all the ossicular chain in a rigidity. Then what will happen? If this reflex is happening, then it causes protection, or it causes protective mechanism from the damaging effect of loud sound to cochlea. So this is why attenuation reflex is happening. Second, it causes masking of lower frequency sounds in louder environment. so that the person can only concentrate on the frequency of sound more than 1000 cycles per second, allowing concentrating on sound above 1000 cycles per second. Okay, so these are the two mechanisms why attenuation reflex or acoustic reflex is happening. Okay, so coming back to the question, increased transmission of low frequency sound due to loss of tensor tympani action. Here the option A is not correct because there is not increased transmission of low frequency sounds, and first of all the tensor tympani action is secondary. So the tensor tympani action here is secondary, not primary, and there is no increased transmission of low frequency sounds, but it causes decreased transmission of low frequency sound. So option A is not correct. Regarding option B, reduced impedance matching leads to decreased sound transmission at all frequencies. The acoustic reflex or attenuation reflex has no relation with the impedance matching. The impedance matching is still intact. Regarding option C, increased amplitude of steppies movement, especially for low frequency sounds. Yes, this option is correct because there is an increased movement of the steppies in low frequency sounds, so that it will protect the cochlea from low frequency sounds. Okay, so option C is correct. So coming to the option D, loss of cochlear outer hair cell function leading to decreased sensitivity. Here there is no loss of outer hair cell of the cochlea, and regarding hair cell, it protects the cochlear hair cell. Rather, this acoustic reflex or the attenuation reflex is a protective mechanism to protect the cochlear hair cells, and there is no relation to the sensitivity. The sensitivity is still maintained. And regarding option E, impaired endolip movement in scala media due to oval window fixation. There is no fixation here. There is no impaired endolip movement. Rather, the endolip is still intact in higher frequencies. So option E, in higher frequency there is endolip movement still occurs. So the option E is also not correct. Option D is also not correct. So here the option C is correct.